Hi, hello everyone. I am Amita from Nourish Talk, a platform for natural and holistic therapies. We are going to be talking about your posture and neck pain. All of us are been working from home for this whole year. We are slouching on the sofa and working, or and then I know I start getting neck pains, and I'm doing my yoga. But that's what we'll be talking with Dr. Karen, who specializes in spine and joint manual therapy, myofascial release therapy, and medical acupuncture. So she will be joining me in 1 second, and we'll be going through what is the correlation of the posture and neck pain, what are the bad postures, relationship between the forward head posture and the neck pain, tips to help with the neck pain. What is it that you can do, like simple exercises. So these are the questions we'll be talking about, and I am just waiting for Dr. Karen to join me, and then we can proceed further. Any questions anyone has, if they're having some neck pain or some issues, feel free to ask questions. Like I said, Dr. Karen is a chiropractor and a medical acupuncturist. So she will be able to help with your questions, simple questions. So while I'm waiting for her, tell us, if anyone has any neck pain right now. And I know most of the people are working from home. So are you having neck pain? All right. So I see Dr. Karen join, and then we should be ready to go. So once we'll be here, and like I said, we'll be talking about correlation of your posture, how you sit, how you stand, and what is the relationship between the neck pain. And this, you'll be surprised. The posture is so important, so that you don't get neck pain. Hi, hello, Dr. Karen. How are you?
Hi, good. I'm fine. How are you doing?
Good, good. Well, welcome, and great to see you. I was just telling our viewers our topic is posture and neck pain. And Dr. Karen is a chiropractor as well as a medical acupuncturist. Maybe you can tell us a little bit about yourself, and then we can go on to the questions.
Yes, thank you so much for bringing me on today and inviting me here. I'm really happy to be here right now. So just a bit about myself. My name is Dr. Karen No. So I am a chiropractor and a licensed massage therapist, as well as I do practice acupuncture in my practice. So I use acupuncture as a way to complement my massage as well as my chiropractic practices with my clients. I'm located in Toronto, Ontario, in Canada, and I am one of the co-founders of Nexus Massage and Rehab. So yeah, that's just a bit about me.
Amazing. Amazing, amazing, amazing. So yeah, I think you're one of the top chiropractors in Canada. I mean, where you are, British Columbia.
Oh yes, yeah. We actually just recently got awarded the Toronto Star Best Chiropractic Clinic in Toronto, so we're very excited.
That's great. That's great. So let's talk about the correlation. The topic is posture and neck pain for today. Everybody who's joining, feel free to ask questions and comments. So what is the correlation of posture and neck pain? I know we've been just kind of slouching in the sofa and working and doing all kind of things, working from home.
Yes. Yeah, there is definitely a huge correlation between the two. Actually, it's really interesting because the correlation is really dependent on what type of neck pain you're talking about. There's three different major types. There's chronic neck pain, there's acute neck pain, and then there's non-musculoskeletal related neck pain. So basically acute just means fresh injury. And then it's chronic, that's when you've had it for a while. And then non-musculoskeletal is it's other stuff that influence neck pain, like maybe stress. So the biggest one that correlates to posture is chronic neck pain. And poor posture is directly related to neck pain because with poor posture, it puts your body at a biomechanical disadvantage, and it causes inefficiencies in your body. And so when there's inefficiencies in your body will try to react and adapt to it. So when it doesn't really adapt very well, then that causes neck pain.
Got it. So, but you said the posture. So what are the bad postures? I mean, I know we have a screen like this, but maybe you can just describe what the bad postures are for viewers who are watching this.
Yeah, sure, no problem. So when it comes down to posture, there is a misconception with bad posture is the only thing that it causes directly relate to neck pain. But actually, it's not like that. It's more what kind of posture in what relation that you're currently doing, and how long are you doing that certain task. That is that combination that really brings on the neck pain. So it's not actually like let's say I'm only in a bad posture for, let's say, 1 second and you get out of there. It's not necessarily like it's going to cause you neck pain. It's like I'm in a bad posture for a really long time, or I'm just like working working at my desk for a really long time in that posture, then that brings on neck pain. So it's actually the immobility and the prolonged not moving that actually brings on that problem. And the most common ones in terms of sustained bad posture that causes neck pain are neck flexion, which just means looking down like this. So it means you're looking down for a long time. Yeah, and this is very common in people who are, let's say they're reading, but like their book is way too low, so they're like this on, like while they're on the bus or on their couch reading. Texting is a really big one since technology. So texting on the phone, really low. Another type of bad posture that's very, very common is called the anterior head carriage. So this is a bit slightly different from neck flexion. So neck flexion is when you're looking down. Anterior head carriage, when your head is protruded forward like this. Okay, and that's actually very common for people who are on their laptops all day, watching movies, working at their desktop. So that's actually a really, really big one too.
So you talk about forward head posture also. I was reading on one of your articles, and then correlation. Okay, some correlation with the neck pain. So what is the forward head posture? Is just like this, what you just described, like kind of putting your.
Yes, I will actually go into that. I brought my friend with me.
Oh,
Here's
wow. That's funny. That's really funny.
To help
understand.
Yeah, to help explain this a bit better. So neck flexion is actually looking down like this. Okay. Anterior head carriage is when your skull is pushed forward like this. Like you're actually putting your chin out like this. Yeah, it's very different. And I think in terms of the anterior head carriage, like what is the relationship between that and neck pain? There is actually a ton. So this is probably the worst posture to be in. So one thing is that when your neck is actually protruded forward like this decreases the space up here. So biomechanically, it decreases space up here. You can kind of see if I push it forward, you can kind of see there's a decrease in space at the really top, and that actually causes a lot of joint compression in this level. This is called your COC1 level. This is also called your suboccipital region. So when it causes irritation and joint compression in this area, this can actually affect the muscles all around this area. So all your support muscles are suddenly then affected because it's really compressed in here. Your muscles become really tight in that area, and then it can actually start giving you headaches. Yeah. So besides,
it's all interconnected. Everything is interconnected.
Everything is interconnected. So when there's like a lot of compression in this area, people will start feeling headaches up here as well. They will start feeling headaches even to the sides. So this is one of the things where forward head carriage is related to neck pain. The second thing is because your head is much more forward, this actually causes the center of mass of your skull, because your skull is actually pretty heavy actually. So when it's pretty heavy, when you have a weight that's pretty heavy in front of you, the center of mass translates forward. So the back of your neck, the muscles actually have to pull really hard to kind of stabilize it so your head doesn't continue falling forward. So now you have all these muscles who are in a conflict trying really hard to pull you back. But because they're doing that, this causes a lot of tension going down your spine because your muscles are pulling down this way. And this causes a lot of joint compression in your neck and then into your back. And that's also another way of causing neck pain, which is through the joints. And the last thing why anterior head carriage is pretty bad for you if it's sustained in a long period of time is that usually people who are in this position, they're also, let's say, computing. Let's say they're typing and such like that. So their shoulders is kind of forward like this, typing. Yeah, that's right. And if their mouse or if their keyboard is way too far, they end up reaching. So their shoulders end up pulling their whole arm forward, and this is called the rolled forward shoulder,
Mm-hmm.
and that actually pulls your trap muscle. So a lot of people actually come in with a very common issue is shoulder pain right in here,
Oh
and
yeah,
yeah, and then the chest.
I had it too.
Do you have
No, no,
that?
I had it last year, and I ended up going to the acupuncture because I was doing exactly what you're explaining, like kind of going like, reaching the mouse and not paying attention to my all those muscles here.
Oh, that's great. Yeah, so you already know how to experience that. You already know what it feels like.
Yeah.
Yeah, so your shoulders are pulling your neck forward, and it's pulling this muscle forward, and it's causing a lot of everything back in the back here is overstretched. So then you start to like hunch, right?
Yeah.
Because everything's pulled forward this way, and then some people start getting this protrusion around the CT junction. So this is also very common related to posture.
Mm-hmm.
And then other craziness comes with it. You start developing what we call trigger points. So
Okay.
when muscles are very, very tight, they start to develop all these little bands in these regions at the neck or even at the back. And then these bands are actually like also like kind of like little muscle contractors. So if you feel sometimes like in your neck, you're like, oh, what's that bump? Like it's really tender. That's kind of what it is. And if it gets really, really bad, it actually, because it's a contractor of muscle, it is not, the blood circulation through that area becomes really poor. So they don't actually get good blood flow in that area. So they start to decrease oxygen in this area. So then you start to develop muscle pain, but also not just muscle pain. You start to have like symptoms going up your head, like causing headaches, as well as symptoms down your arm, causing numbness, tingling, and shooting things down your arms.
Wow, wow, that's, I mean, I love the way you've explained it with the skeleton. So I think everybody understands, because
Yeah, I really.
and that's what we are going to be reduced to after whenever, who knows.
Yeah, yeah, we'll see how this. I hope that was very clear.
We have to have a laugh also. But I think no, it's amazing. It's so clear, the way you described. And so let's talk about the tips to help with the neck pain. What is it that we can do? There's some simple exercises that to help with the postures. How can we do that while we're all stuck at home right now? We can't come to you.
Yes, I know it's very, very unfortunate during those times. Actually, well, we hope, because right now we are under lockdown, but for essential services like clinics and such, those are still open. So we are actually still providing services, but who knows, maybe the next few days, they're like, okay, we got to shut down everything. So yeah, just in case, here are some few tips that you can do. So I'm going to give some general tips to start, and then we're going to get through some exercises, stretches that will be beneficial for everyone. Okay, so the first tip, I'm going to put this guy away.
Oh yeah.
Okay, so put that guy away. Okay, so the first thing is, it's very important is to get moving. The problem is that a lot of people, when they're stuck at home, especially right now with the whole life-work balance has been kind of thrown out the window because people are working at home, people are resting at home. So some people, their boundaries have been kind of taken away from them. So definitely get moving. Everyone should be who is at a computer all day. They should be getting up once per hour just to get things moving. So it gives your muscles and your joints a break, and it also gets the blood flow moving to help flush out any waste components that are stuck in your muscles, that are stuck in your joints. And also the blood flow also brings in nutrition to those areas to help heal. So if you're not giving your body enough blood flow to heal, right, you're gonna always be in pain. So that's one. Second is that you need to set up your workstation properly. That is the biggest thing now that the COVID pandemic has kind of forced everyone to work at home. A lot of people don't really have a good setup. So it's very important that even to contact, let's say, because I know a lot of, even for our clinic, we offer virtual visits now. So people can talk to doctors like our chiros or physios or osteopath or acupuncturists, even online, right? So they can give you advice on how to set up your work station properly. So then you're not always working in pain. Like there's a world that you can live without pain, guys. And,
You know, working from your bed, right? So sitting in the bed and kind of never getting out. That was our dream, right? We used to dream, oh, I wish I could never get out of the bed. That's what people are doing.
Exactly. Yeah, exactly. And people are there after, even with their get treatment, they go back to their station, which will break them again, and they'll get pain, and then they go out for treatment again. So it's like a very, very vicious cycle. So definitely high on my priority list. When every patient that comes in here, I always tell them, bring me a photo of what your station looks like and you in your station. So we need to realign everything properly. So when we treat you, you don't break yourself later. Yeah. Okay, so that's 2. Number 3, if you have pain, just go see someone. Like, don't wait. I do find that people who actually get treatment early, their problem resolves way faster, rather than like you wait months, years, and then it takes longer to resolve. So definitely see someone about it. 4th, do some self-care at home. So for people who are getting, let's say, soreness, the aches, the dull pains in their neck from work specifically, if it's not from work specifically, you got to see someone else for that. But if it's from work, you find that you have a lot of muscle tension, like put a warm towel around it. You know, get a heat pad. Those are great. Like even like a warm towel, that will help bring, because with the warmth, it helps generate blood flow to the area. So then it helps kind of loosen up your muscles slowly. It's not, it's not going to fix you completely, but it will help manage your symptoms. For people who are actually getting sharp pains, let's say they have radiation pain down the arms, sharp pain in the shoulder, sharp pain in the back, ice compresses are really good.
Yeah.
So yeah, like the gel ones are really good. Like don't get the hard ones that come with like Good Foods or something like that. Like don't get the hard ones. Get the nice soft ones, like the gel ones, or you can crush the ice and put it in a bag. Those are great too. 30 seconds on, at least, and then 10 seconds on, 10 seconds off, three times cycle, and that should give you a ton of relief already. Now, when we're going into exercises, I have posted some in my Instagram. You can definitely check those out. I think I posted like 2 videos on neck pain and back pain, and one on a bit covering ergonomics, but I'll kind of go through some of that today. So for those who have anterior head carriage, I'll show you with this guy again. So the ones with anterior head carriage, right, a really good exercise for is actually doing chin tucks, right? Like bringing the chin back towards here. Yeah, like that. Okay? Yeah, because the reason for that is with chin tuck exercises, it helps activate your front muscles in the neck, and then it helps stretch out the back. So I'll show you on my side. So when I'm doing exercises, let's say with the chin tuck, you can see my side profile here. Let's say my head is stick out like this. Yeah. You're just doing gentle chin tucks like that. So bringing
like that.
Your chin tucks. Okay. Yeah. And this, it's not a very attractive exercise. It gives you double chin, whatever. But, you know, it's going to help you with your posture. It's going to help you with your muscle. It helps kind of activate those, and eventually that will look great. And it's not going to give you a double chin. Okay. So you're going to hold that for 7 seconds and then release. Okay. So when you're doing it, you don't want to be looking down or looking up doing it. You just want to make sure it's nice and straight and you're going back straight. Okay.
Okay.
Yeah. So that one's a really good one for, especially for people who have headaches at the back here, because that's where, remember where I talked about this guy, when his head is forward, it compresses the back. So with this exercise, it opens up the back. So it actually helps with your headaches. So for those, I have like headaches coming from this region.
Got it. Got it.
Yeah. So that's a really good one. I would recommend 7 seconds hold, 3 sets of 10 daily. Those are really good just to kind of get things started and fired up.
Okay. Yeah. Well, we have a question, but it's not related to neck pain. Someone is asking about PMS. The topic is actually posture and neck pain. So I don't know if we can talk about PMS here.
PMS, it's usually, okay, so with cramps and pain from, from period, it's usually due to a lack of blood flow and oxygen to that area. So exercise is really good, as much as people don't want to exercise during their period, but that's actually a really good way to bring on the blood flow, because when you go through your period, like, a lot of blood flow is lost, right? So bringing blood flow to the muscle in the pelvic region is amazing, because then it brings oxygen to it, it gets things moving, and it helps a lot. And I heard that actually someone told me, like, like belly dancing is really good because they use muscles of the pelvic girdle and your abdomen, and it actually helped my friend a lot. She doesn't have any pain from her PMS anymore because she started belly dancing, and that's actually really good. So basically, anything that's related to generating blood flow to that region is excellent for it. But if it's but you need to there's some that are a bit more complicated, and it's not just exercise that's going to heal it. If you have something else going on, then I really want you to see someone for, like, an acupuncturist or even your family doctor to make sure you get things scanned, to make sure there's nothing else going on, because there's many things that can cause, like, period pains.
Sure. All right, back to our neck pain. So the chiro and the acupuncture, how do you combine that for neck pain? All right, someone is saying, can you please some light exercises, especially for that pain? Which pain are you talking about? You know, we can have a separate section of PMS. Because this is a neck pain topic. So let's focus on neck pain, please. So let's, if anyone has a neck pain issues, please come on out. PMS would be a separate topic. I'm sorry.
No problem. Yeah, if anyone wants to message me after the interview about, like, other exercises for other regions, feel free to.
All right, someone is asking, we don't want to drive Dr. Karen away. So someone is saying acupressure for heel pain. Okay, now we're going all over the body.
Yeah, I'm going all the way down to the leg. This is really cool. I love you guys. You guys are amazing. I like people, like, random questions coming up. It helps drive my thoughts.
Absolutely.
Okay, but yes, I will answer those questions. If you can private message me outside the interview too. I can definitely answer those questions if we have time afterwards. But we'll try to stay on topic for neck pain, and then afterwards, then I'll try to get through the other questions. Okay.
Absolutely. Yeah. So let's just stay in neck pain and see how chiropractic and acupuncture, how do you combine it in your practice? I think that's the question.
Okay. Okay. So I use acupuncture quite a lot in my practice. I find that every patient that comes through my practice is very different. No matter, like, let's say if a person comes in with neck pain, and then another person comes in with the exact same problem, their body might not respond to the same type of treatment. It happens like all the time. It could be because maybe their body is not receptive. Maybe the duration of they've had it for it is different, or their lifestyle is different. There's just something about their body that, like, people just need different combinations of treatment. So everyone is kind of like a puzzle walking in, no matter if they have the same thing or not. Okay. So how I use it in my practice with chiro, I usually do, let's say if joints are locked up, I usually do adjustments or mobilization to free up the joints so they move better. And that in turn helps relax some of the deeper muscles into the neck, because when muscles attach, these muscles that are tight in the neck, they also attach to these same joints that don't move very well. So when you release the joint, it helps release the muscle. But I also do a lot of muscle work with my patients to release the muscle too, because sometimes they need a bit of more push. Like, adjustments are not enough sometimes. And for some patients, let's say they have, like, the trigger point that I mentioned, which is the band of muscle contractors in their tissue, which doesn't let go. It's just really, really tight. I use acupuncture to help break down that muscle knot. Sometimes I just leave it there. It will slowly kind of let go. As well, sometimes I use acupuncture to provide blood flow to certain areas. So let's say if your back in general is pretty tight, I would do some acupuncture points. And what acupuncture does is, when you insert the needles, it causes a very small amount of inflammation in the area. And that's the first stage of healing. It's to help reset the cycle and to bring in blood flow. So that also helps a lot with headaches. So some people get headaches because, let's say, the neck is really tight. Bringing blood flow just to that muscle that's pulling on your skull, causing the muscle pain to refer up to your head. That helps a ton with headaches. Jaw pain, same thing. I use it as a complementary treatment to that. And then other things that I use acupuncture in combination with chiro is people that have nerve pain. So I find acupuncture like really, really good for people who have sharp shooting pains, even numbness and tingling that, let's say, when I do the muscle work, that's not releasing. When I do the adjustments, it's not, it's not getting the full effect. So just combining acupuncture on top of that can bring such great relief for certain patients.
Absolutely, absolutely. I go for acupuncture regularly, so I can vouch for acupuncture. It's amazing, absolutely amazing. So I think there was a question I saw on the sleep postures related to neck pain. I think that's a relevant question for this topic. We are not going off board and down the body here. So, so sleep posture, do you want to comment on that?
Sleep posture. Okay, yes. Sleep posture. Yes. Oh, sleep posture is huge. Yes. Okay, so
should we have a separate topic on that, the sleep postures, or should we just?
I can just quickly make like a recommendation for that. So it's really dependent on how you sleep and what kind of sleeper are you. So typically, I recommend people to sleep on their side. I find that's usually the most neutral position for their spine and their neck. But when they sleep on their side, you need to make sure you have a good enough height for a pillow to kind of fill that space between your shoulder and your neck to give your neck a good support with that. Yeah. For people that sleep on their back, because when they're sleeping on their back, they shouldn't use a very high pillow, because if they use a very high pillow, it pushes their head forward during the sleep, and that actually causes a lot of muscle pull during the night, and that can definitely cause neck pain. Definitely. So if you're going to be a back sleeper, sleep on a thinner pillow. Yeah. Okay. And I'm not even going to comment on people who sleep on their stomach. They're like the worst. So it's like the worst for your back and worse for your neck. So people who actually sleep on their stomach, they cause a lot of joint compression in their low back because their body is raised and their low back's compressed the whole night. And because when you're lying face down on your stomach, your head is always turned to the side. You're causing joint compression on one side, you're pulling muscle on the other. So it's just not really recommended. And if you can get out of posture, I highly recommend you do. If not, then we're going to just keep trying here to find the most comfortable position for you. It's definitely difficult.
That's great. That's great. I think you've provided so much amazing information for all of us to do what we can do, self-care at home. For other topics, we'll have a separate session because everybody loves Dr. Karen. They're coming up with all the questions. So we will, we respect Dr. Karen's time. So what we want to do is we want to keep it as a separate topic altogether. But for neck pain, she has given us so many different information and tips to how to sleep properly, how to, do the simple exercises, how not to do your neck kind of, the way she was describing with the skeleton. So, watch this video again, guys, and learn, because I know there's a lot of information to kind of digest. So watch it again, and hopefully no neck pain will be there.
Definitely. Yeah. Thank you so much, Amita, for bringing me on and inviting me to this again. I know during this session, I couldn't provide as much exercise tips as I wanted to, but on my Instagram, I have made 2 videos specifically for neck pain and mid-back pain. So if you want more information, definitely try it out.
Yes. Thank you so much, Dr. Karen, for being with us. And thank you everyone for being asking us all these questions. We love you. Thank you so much. Bye now.
Thank you so much.